What's going on, everyone? Happy Friday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu test, maybe it's RSV or some other virus, I hope you have tested negative. If you did test positive for any of the viruses, I hope you have a full and speedy recovery with no long-term and no long COVID issues. It is time now for the Friday edition of the Virus Update for Friday, February 14th, 2025. If you are new to my channel, welcome to my channel. This is the channel that gives you updates on all the viruses that can make us sick each and every day. Much like you get the local news every day, which gives you news, sports, and weather, I give you a virus update. Sometimes they're 15 minutes, 20 minutes, and sometimes they go as long as 25 minutes. I don't think we'll go 25 minutes today, but who knows? So if you're new to my channel and just want to stay informed with what's going on, because let's face it, a lot of people have been sick this winter, and that illness continues. We're coming near the backside of the winter wave, but the backside is going to be equally as bad, even though we're going to start to come down soon. Things are still really bad. If you like this video, give it a thumbs up. Let's try for 200 plus like button hits today. Of course, subscribe if you're new down below. I've had a lot of new viewers lately. Maybe you've watched a few of my videos now and you're thinking, maybe I should subscribe to that channel. Maybe today's your day. Let's try for 10,000 subscribers by the end of this year. Because after all, my purpose here is to inform as many people as possible on just what's going on with these viruses. Because so many people are not aware that, hey, there's a lot of different viruses that could make you sick. COVID's the cream of the crop. That's the one that made me start this channel, but now we've branched off to all those other viruses. Of course, share this video with anyone you know. Leave your comments down below, and don't forget to hit that notification bell. All right, we have just a few news stories today. I didn't do a lot of research, and when I did do some research, wasn't finding as many news stories. That's an encouraging sign, because if you've been someone who's been watching my channel here day after day after day, you know this last month or two have just been insane for news reports, whether it be reports of flu being way up in some areas or various other different things. But I got a feeling we're going to continue to be busy for some time because there's quite a few viruses out there still. All right, starting off with Michigan. And Michigan is having problems with H5N1 bird flu in birds. More than 300 dead birds have been found. Yeah, this is something that we're seeing happen in many different states. And, well, it's happening in Michigan as well at various different parks. So this is not a good thing to see. Moving on now to this. Flu cases are starting to rise in Hawaii. And 19 deaths have been reported so far this season. Doctors nationwide said this is the worst flu season in 15 years. Now, mind you, I got to tell you something. This article was posted yesterday. Data that we're going to see today. The CDC did update today. They updated a lot of things, including COVID variant data. But anywho, the point I'm driving at is data we're going to see today were worse than 15 years ago now. Some are saying this may be the worst since CDC started online public database, tracking. So we're going back to the early 2000s now with how bad things are on the nationwide level. There have been 13,000 deaths at the time of this article being posted, and 57 children. And we're going to find today with new data, I won't be showing you the new death data, but it's likely higher than that now. Sadly, it has been that bad of a flu season, and Hawaii is starting to rise as well. Taking a look at this, flu in Kansas is on the rise. Again, this is now the worst flu season, not 15 years, but probably over 20 years now, maybe 25, almost 25 years. Yes, this is a really bad flu season. Again, some of these stories I queued up last night. All right, I have to tell you about this. This is coming from Dr. Scott Gottlieb. Whether you like him or not, that's not the point here. The point is the data that he is sharing with us. Texas, we've been talking about this again and again. And, well, there's an update on the measles outbreak in Texas, and it is appearing to be getting worse and fast. Update on Texas measles outbreak. Cases doubled this week, up to 48 known infections now. Most patients are under the age of 17. All of these cases are believed to have occurred in unvaccinated individuals. And there was something that I did not mention yesterday, wasn't going to, but given that we have this news now, I got to briefly mention this. Robert Kennedy Jr. has been confirmed as the new Secretary of Health. He's going to oversee our health in the United States. And he's not a big fan of vaccines. I'm not going to get into the whole, is he going to ban vaccines, this or that? But the point is, when it comes to measles, all the cases, at least in Texas right now, are unvaccinated. Just saying, all the cases in Texas right now are unvaccinated cases. So, yeah, that is not a good thing. Now, moving on to this. We're talking about the band, the Eagles. We're not talking about the Philadelphia Eagles. We'll talk about the Philadelphia Eagles later. The band, big in the 70s and 80s, big rock group here in the United States. Well, the Eagles guitarist, Don Felder, 77, has suffered a shock medical emergency on stage. Apparently, he was singing their song, big hit song for them, Tequila Sunrise, on stage when he abruptly stopped speaking. He just apparently was unsteady on his feet. A crew member rushed on and cradled Felder as he attempted to speak into the microphone, and eventually he was escorted off the stage with his bandmates, and the crowd shouted support, and he was taken to the hospital. We don't know what is going on, but yeah, apparently he just stalled. And you know what? There's been a lot of people, we've been seeing that happen. There's been a few political figures here in the United States that are speaking or whatnot, and they just suddenly stop. I mean, it's been happening lately, so not good, and well wishes to Don Felder of the great band, the Eagles. All right, moving on now to this. Hey, here's my website here. Just a reminder that my website is datareport.info. We have several tracking threads that are up. Let's take a look at today's post. There's been postings in a few of them. International sports thread. List of performers sick in 2025. The reason why we did that thread, well, I'll show you why. Let's go to Celebrity Health News, because it was oh so popular last year. It was viewed over 4,700 times. So I said, people want to know what performers are getting sick. So I said, you know what, let's do it again this year. And we have oh so many others. I mean, who else? I mean, where else can you get compiled lists that is tracking all these things? I think it is something that needs to be documented in time of just what goes on, whether it be a virus, someone getting ill, whatever the case may be, and then we track a bunch of other things. There's a measles thread. There's I'm going to be adding that Dr. Scott Gottlieb note into that. There's sports illness threads. We're tracking tuberculosis, chronic wasting disease, and then, of course, COVID studies, and all these different things you can find out about on my website. Like if you click on long COVID studies, well, guess what it does? It gives you a list of studies. You click on the thread, and it links you to one of the studies. For example, it shows here, here's one. Study shows for most long COVID symptoms persist into the second year. You click on that, and guess what? There's the source. You click on the source, and it takes you right to the actual post or study or report. So yeah, datareport.info if you're looking for anything on that. In Canada, I need to refresh this. Let's see if there was an update. COVID-19 viral activity level is moderate. Flu A is high. Flu B is moderate. And RSV is high. All these levels have been floating between moderate and high for several weeks now. We hope to see that come down relatively soon, which it hasn't been doing. It'd be nice to see them all say low once again, wouldn't it? Taking a look at air qualities in the United States, if this does low. Oh, there it goes. West Coast still dealing with some problems. Seems to be, if we go up to that I-90 corridor, or I-94, I-80, that seems to be the worst area for air quality today. And then plus the plains. And that's going to be a problem that we'll probably note in tomorrow's virus update as well, because there's going to be a big storm system that develops. I mean, a huge one. It's actually going to be severe weather down the southeast, and ahead of that, there's going to be some moist air that may cause some air quality problems. Speaking of weather, I've done something I haven't done in a very long time since COVID hit me, and that is I posted an update over on my Climate Data Report channel. Yes, I have another channel where I do, once in a while, weather videos. As you can see, it's been over a month. I talked about tomorrow's severe weather, and I talked about the threat of a snowstorm in the East Coast next weekend. I'm not going to do everyday videos there again, but at least a few times a week or as needed. And right now is an as-needed time because there's a big severe weather threat in the south for tomorrow. So that is climate data report. Taking a look at Pinellas County, Florida, we do see the word sick person mentioned several times. 1, 2, 3, 4, at least 5 times, and a whole bunch of other calls as well. Very busy in Pinellas County, Florida at this time. In Philadelphia yesterday, 871 EMS calls. That is a pretty high number. It'll be interesting to see what the number comes in for today. We had the Philadelphia Eagles championship parade. I have to mention this. The city was expecting 1 million people, or over 1 million people. I think they got that and then some. I watched some of it on TV. The crowds are absolutely insane. And someone's going to say, well, it's outdoors, it's fine. Okay. You also have the problem with people getting there, and plus people were just literally standing on top of people. I saw people perched up on water fountains. I saw people, parents with children on their head. It was just insane how many people were there today. And then, of course, many people are packed on the trains, and I saw the lines for the trains, which are like, holy cow. Yeah, they got more people than expected today. It was absolutely insane. I mean, I get it. It's positive vibes for the city, but some people are going to get sick, and I know someone's getting ready to comment, so someone gets sick, life goes on. No, life doesn't always go on. Some people lose their lives to these viruses. Yeah, deaths do occur with these viruses. Taking a live look at what's going on outside of Philadelphia. Wow. Montgomery County, Pennsylvania, 1, 2, 3, 4 respiratory emergency calls right now, and a few other things. How about Chester County? Let's see what's going on there. Chester County's pretty busy as well. That's despite the fact that people from all over flocked into the city today. So there are still calls going on. And again, I don't know what the city is today. It's going to be very interesting to see what happens in the weeks to come. We don't get daily or weekly wastewater data in the city itself, but some of the surrounding counties we will get updated through the Pennsylvania dashboard and wastewater scan. So we'll be able to see if it causes any increase in the outside counties of Philadelphia. Taking a look at what's going on with hospitals in Pennsylvania, there are some hospitals having problems. The Lehigh Valley looks to be getting hit hard today. Some hospitals in southeast Pennsylvania as well, and also central Pennsylvania, like Harrisburg region, capital area of Pennsylvania, do have problems. And take a look at this. High patient volumes at 1, 2, 3, 4 hospitals in New Jersey are dealing with various different issues at this time. Taking a look now at Walgreens this week, COVID positivity rate is 10.2% at this time. Skipping over wastewater scan for today. Reason being for that is we will get to that over the weekend. Let's take a look at New York State, and I do need to refresh this. And New York State reports today 1,571 cases, which does slow that drop just a little bit because that's actually a higher number than yesterday. And let's refresh to see the hospitalizations. And the hospitalizations did drop from yesterday's big number. Today's hospitalizations are 853 in New York State. All right, now taking a look at CDC. And I wanted to start off with the influenza-like illness activity level, but I wanted to rewind it back to October 5th. And you can see on October 5th, we were not doing bad here in the United States. And as we advance this, we can see Washington, D.C. was the first state to really start to get hit hard, and eventually Washington, D.C. did go high rather early. Then we saw Georgia go moderate as we head into around Thanksgiving. Then post-Thanksgiving, the map started to fill in a little bit more. Here's mid-December. Then we got towards Christmas, and kaboom! The map just really went crazy. Then we had January come. And by January 11th, we were doing a little bit better. But now watch what happened nationally after that. You're starting to see this purple color show up. And you're starting to see it show up a few times. Purple is the highest level on the influenza-like illness activity map. Look at this. Now we're the first week of February. Let's count how many purple states there are. You got Washington, which is 1. Oregon, which is 2. New Mexico is 3. Nebraska 4. Kansas 5. South Carolina 6. Tennessee 7. Virginia 8. Maryland 9. New Jersey 10. 11 being Massachusetts. 12 New Hampshire. 13 Ohio. 14 Michigan. And though not a state, New York City is very high as well. 15 different places on this map that are in the purple. And there's other shades of very high as well. You got Maine, you have Texas, you have Oklahoma, Louisiana, Arkansas, Georgia, North Carolina. You have Indiana. Yeah, this map is not looking so good at this point. Oh, and also if we look really closely, Rhode Island is very high as well. Then you have another shade of very high below that. More states are very high than they are the other colors at this point, and Washington, D.C. is still very high at this point. Really, really bad. And incidentally, we mentioned Hawaii at the start of this video, or near the beginning of this video. We can see Hawaii is actually minimal at this time. We'll have to see if that holds. But, yeah, this map, I mean, you can just see here. This is the worst I've ever seen for this map in terms of number of purple states. Really bad. Alrighty, moving on now to some virus trends. A correction was made last week, a correction that we thought might get made because New York State did not have very many wastewater sites reporting. And that is, first off, the national level. It's not rising as much this week because of the correction that was made in the Northeast. Remember last week? I almost said next week. Remember last week we saw a big rise in the Northeast? Well, guess what? That got corrected. It's not as harsh now. And New York State was part of the problem as to why that rise was showing up oh so harsh. When we take a look at the West Coast, we can see the West Coast did rise a little bit, but now it's starting to level off. Unfortunately, the Midwest, once again, may be starting to do some sort of a rise again. And in the South, it looks like we are starting to get a peak and a drop. All this equals to the national level, kind of leveling off a little bit. We're in the high category at this point. We're not very high, but we are in the high category. And no region for COVID is in very high at this point. Alrighty, taking a look now at Influenza A. Tiny bit of good news. I think you're going to like this. Influenza A. It's not going straight up anymore nationally. Yeah, it's very high. I'll give you that. It's very high. And like I said, given that we are very high, the backside is going to be equally as bad. There's going to be a lot of people infected. But we're not seeing this rapidly go up. Yeah, it went up a little bit, but not rapidly rising anymore. That's a sign that maybe, just maybe, we can finally see a peak for this virus season. And hopefully, this is a peak that lasts and we don't see another one of those, oh, well, peaked and now it's going up again. We'll have to see what happens next week. Places like Pennsylvania, parts of New Jersey, Delaware, maybe some other surrounding areas, maybe not so fast. I think eastern Pennsylvania, flu is going to live on for a little bit longer because that big Eagles parade, all those people there today, the viruses are going to have a field day with that. All right, surprise. We got a variant update yet again this week. And not one I'm happy about. XEC is now at 37%, but LP.8.1 has now jumped up to 31%. It's really going up there. So it's something we're going to have to continue to keep our eyes on. KP 3.1.19%, MC 10.16%. But then you see there's an XEC.4 variant showing up now. It's a subvariant. That's at 4%, but again, LP 8.1, that's likely to be our next variant that takes over. Alrighty, moving on, and we're going to skip over that one. In the hospitals, let's refresh this. The hospital capacity usage this week, hopefully that has updated. I've been waiting for it. It has, 77.2%, because the previous number was 77.3%, but 77.2% of all inpatient beds in the United States are being used at this time. All right, taking a look at percentage of emergency department visits diagnosed with COVID. Good news. That is dropping at this time. You can see that red line starting to go back down again. You know, a roller coaster goes up, it goes down, sometimes it goes back up, and it tried to, but then it flattened, and now it is starting to drop once again. So that is good news. Epidemic status. Influenza. It's still growing up in Maine. It's still growing in Montana. Likely growing in Alaska and Hawaii. Everywhere else is not changing. Likely declining or declining at this time, or just not even estimated. And when we look at COVID, it's only likely growing in Kansas and Colorado at this time. And then a lot of other places are likely declining or declining. And a vast majority of states are just not changing at this time. All right, moving on now to this, and we want to take a look at the weekly positivity rate, and it's still showing up as 31.6% for influenza in the United States, and we can see here that emergency department visits and all that, yeah, we still got some work to do here in the United States. Again, this is, as of February 1st, so this has not actually updated here, and I would have to, find this week's summary. Maybe I'll do that for tomorrow's video. All right, let's take a look at LA. Some good news here. First off, Hospitalizations, they still, they dropped a little bit. Deaths look like they may be trending upward a bit. But take a look at this. Cases, though, they went up quickly, just as fast as they went up over the past few weeks. They are starting to drop now. And testing, the positivity rate, it's not really dropping yet, but those cases are, and that's good news. Wastewater went down a little bit. Now it's gone up a little bit. Emergency department visits starting to drop at this time. All right, we do have some data from CJS today, something a little bit different. He provided us some flu numbers. So let's go through that. Kentucky reported 11,215 new flu cases this week after 8,645 last week. That number was revised from 8,637 last week. San Diego County in California, 3,095 new flu cases and 32 new flu deaths reported over what was being shown last week. Not good. Colorado, a flu test case positivity rate this week of 24.8%. Oregon, 24% flu positivity rate. New Jersey, oh my, 12,732 flu cases for the week of February 2nd through 8th, 2025, which is actually a slight decrease from the prior week. New Jersey had 4 consecutive weeks over 10,000 flu cases. That's really bad. Virginia, 3,787 positive flu tests, which is actually fewer than the number of positive COVID tests they had for the week of February 2nd through 8th, and a decrease from the over 5,000 flu tests Virginia had for the week of January 26th through February 1st. Alrighty, folks, before we end today's video, I almost forgot to do this. Got to remind you, take a hydration break. Today we're drinking juice. Water's very good. Remember to keep yourself hydrated. It is very important. Let's pause and do that now. Alrighty, I feel hydrated once again. I hope you do as well. That does it for today's virus update. We will have an update again tomorrow and on Sunday as well. And then Monday comes my important doctor's update. Of course, I will update you how that goes, which path we're going to go with all my new issues. And of course, we'll watch next week to see what happens. Hopefully, we're coming near the peak, the national peak of flu. And hopefully this is one that sticks and drops and stays dropping this time. I will see you all again tomorrow. But until I see you again tomorrow, gotta do me a favor. Thumbs up if you like this video. Subscribe if you're new. Hit that notification bell. Share this video with anyone you know. Leave your comments down below. And stay safe. Have a fantastic weekend. Enjoy your Valentine's Day. I forgot to mention that. Today is Valentine's Day. Happy Valentine's to all who are celebrating that today. Hopefully you're doing that safely. Alright, take care. See you next time. Thanks for watching.